Hi, I'm Dr. Scott Lee. Today I want to talk about how living with AFib affects couples. See, AFib doesn't just affect the person who has it, it affects relationships too. Some patients feel dismissed by their spouse, while others minimize their AFib symptoms and risks, and that leaves their spouse worried and frustrated. Today, let's talk about how couples can better understand each other when AFib enters the picture. So let's talk about it from the patient's perspective, the one who actually has AFib. Well, you're living with AFib, and that can mean symptoms like extreme tiredness, fatigue, serious palpitations, anxiety, fear of a stroke. As a patient, you may feel like your spouse just doesn't understand how disruptive this is to you. They may just say, it's just an irregular heartbeat, something that is kind of dismissed. But for you, it's exhausting and sometimes scary. Having your spouse just acknowledge the symptoms and the impact can be as healing as the medications themselves. What about from the spouse's perspective? On the flip side, many men, especially, tend to minimize their AFib symptoms. They'll say, I'm fine, or it's just stress, while you as the spouse see them skipping medications, drinking, or ignoring their doctor's advice. This leaves you as the spouse carrying the anxiety about stroke risk and long-term health. It's very scary and frightening. You may feel like the health police, which strains your relationship. So why does this matter? Untreated or poorly managed atrial fibrillation isn't harmless. It increases risk of stroke, potentially heart failure, and increases the number of hospitalizations. See, the goal isn't to argue about symptoms. It's to build teamwork around staying healthy and preventing serious complications. So what are some practical strategies for couples? Well, for the patient, just be open about your symptoms, even if you're tired of talking about them. Don't minimize your AFib to spare your spouse worry. That actually increases their worry. Invite your spouse to accompany you to the doctor's visit so they can hear the plan directly and ask and answer all of their questions. What about you as a spouse? You need to validate what your partner is feeling, even if you can't see or feel the symptoms yourself. Try not to lecture them. Instead, ask, how can I support you in sticking with your treatment plan? Help with practical things like helping them track their medications, making sure they have heart-healthy meals, and exercising together. If you're worried, say so and communicate openly and honestly, but frame it as love and concern, not nagging. And then finally, just try to reframe this all as a team effort. See, the healthiest couples that I've seen approach AFib as a we problem, not a you problem. This means we eat heart-healthy meals. We walk after dinner. We keep track of appointments together. When it's a team effort, the patient feels supported and the spouse feels empowered rather than helpless. If you or your partner has AFib, remember, you're in this together. Understanding and support from both sides makes the biggest difference. I'm Dr. Scott Lee. I hope this helps your family navigate AFib, not just medically, but emotionally. If you like this video, please hit the subscribe button. And for more AFib resources, feel free to visit my website at drscottlee.com. I hope this helps, and thanks for watching. For everything atrial fibrillation related, please feel free to go to my website, drscottlee.com, where you're going to find more resources and also can follow me on social media.